Hello, all, let's learn about consensus-based antimicrobial. Global Action Plan on Antimicrobial Resistance sets out 5 strategic objectives as a blueprint for countries in developing National Action Plan on Antimicrobial Resistance. These 5 strategic objectives are improve, strengthen, reduce, optimize, and develop. The objective is to improve awareness and understanding of antimicrobial resistance through communication, education, and training. In strengthening, it means strengthening the knowledge and evidence base through surveillance and research. Reduction involves reduction in the incidence of infection through effective sanitation, hygiene, and infection measures. Optimization the usage of antimicrobial medicines in human and animal health. Development involves developing the economic case for sustainable investment that takes account of the needs of all countries and encourages investment in new medicines, diagnostic tools, vaccines, and other. What are the overall objectives? The 3 pillars of an integrated approach to health system strengthening. One is antimicrobial stewardship, another is infection prevention control, third is the medicine and patient safety. When applied in conjunction with stewardship surveillance and WHO essential medicine list, that is AMR aware list, the AMS program helps to control antimicrobial resistance by optimizing the use of antimicrobial. The integrated approach to antimicrobial optimizing usage of antimicrobials towards universal health coverage is depicted in the present slide. It involves regulations, supply chain management, access to antibiotics, antibiotic usage, surveillance of antimicrobial resistance and antibiotics, immunization, infection control, and water and sanitation hygiene. The AMS committee should comprise of ID specialist, clinical microbiologist, pharmacist, infection control expert, information technology expert, hospital administrative representative, nurses, and other physicians. Why physicians are reluctant to stick on to AMS? Because they are concerned about the outcome, concerned about the coverage of antibiotic, confidence on the level of microbiology department results, comfort level of covering all the organisms, fear of litigation, knowledge gap, relying on experience rather than evidence, unreliability of the antibiograms, time constraints faced by physicians. Cases can be divided into following verticals. One is faculty related, patient related, and facility related. Faculty related involves confidence building measures, competency development, closing the knowledge gap, while patient related issues can be solved by realistic expectations and reasoning judiciously. Facility related issues can be solved by leadership commitment, patient safety priority, departmental standardization, and strong AMS. What is the overarching objective and overall perspective? The healthcare facility AMS action plan provides an overview of the facility AMS program with overall goals, how they will be reached, and by whom, and how progress will be measured. However, having a plan is not enough, it has to be implemented. Behavioral change in antimicrobial prescribing practices leading to more responsible use of antibiotics. Implemented AMS program is a strategy for changing this behavior over time. AMS interventions should be implemented in a stepwise approach, build on existing structures, maximize the teamwork, and encourage the champions and clinical staff, including prescribers, to participate. Start small and keep it simple and doable. Bottom line is, use the evidence-based interventions is no guarantee of success because success depends on implementing the interventions. 2 ways of tailoring the AMS interventions are to involve the clinical staff in identifying targets, to have a systematic approach to implement the AMS interventions. The question to address while applying the quality improvement model for AMS interventions. What are you trying to achieve? Set a goal for changing the antibiotic usage, that is SMART goals. SMART means specific, measurable, achievable, relevant, and time-bound goals. And how will you know to change that the change is an improvement? Determine what measures you use to show the improvement. Then what changes can you make that result in improvement? Not all changes are an improvement. Identify the behavioral changes that will result in improvement. What are the key steps to establish the program? SWOT analysis, establish sustainable AMS governance structure, prioritize the healthcare facility core elements, identify the immediate priorities, identify AMS interventions, implement, monitor, and evaluate AMS interventions, offer basic and continued educational resources, and training on optimized antimicrobial prescribing. What are the basic requirements of program? Educate the prescribers, develop and update medical records and charts, review whether patients who receive antibiotic treatment, review antibiotic treatment for patients prescribed, review the dose of antibiotics prescribed, review the prophylaxis where it is prescribed more than 24 hours, and where a single dose is appropriate. Basic requirements of program includes development of local guidelines, work to ensure the leadership and identify expertise, improve the supply and management of medicines, work to establish basic microbiology lab facilities, work to establish regular surveillance activities. Do a SWOT analysis, understand the strains such as core elements, human resources, antimicrobial pattern, and AMS activities in place. And identify the weakness, that is core elements. Regarding the core elements such as no medical records or no professionals or no supply of microbiology reagents or department and AMS activities. Identify the opportunities and the threats accordingly. Intrinsic factors to look for in behavioral change model involves perception that AMR is an immediate threat, fear of losing a patient, belief that broad spectrum antibiotics are very effective, influence of a senior physician's preferences, and uncertainty due to inadequate microbiology. The 9 common areas for improving antimicrobial prescribing involves overprescribing, over broadly spectrum, unnecessary combination therapy, wrong antibiotic choice, wrong dose interval, wrong route, wrong duration, and delayed administrations. Accordingly, improvement measures should be in place to address these 9 common areas for improving the antimicrobial prescribing. Now let's see the flow algorithm for the implementation program. First is to prepare, map the enablers and barriers in the unit according to SWOT analysis. Plan the AMA program challenges in the usage and discuss what we can do. Set the SMART goals, decide on the interventions, and then perform the interventions, education and ward rounds and measurements. Study, analyze the measures, what do they show, evaluate the interventions, prepare to discuss the results, review the resources, and then adjust, decide the results and interventions with the unit, agree on adjustment, follow up with the continuous improvement cycle, that is plan to study. Then the types of interventions for improving the prescribing practices involves persuasive, restrictive, and structural. Persuasive or educational involves educational treatment guidelines, surgical prophylaxis guidelines, while persuasive feedback involves audit with feedback, ward rounds, antibiotic self-revision, redundant therapy, review of the antibiotics, dose optimization. While restrictive means restrictions on the antibiotic utilizations, automatic stop orders, computerized physician order entry, antibiotic allergy assessment. Structural involves rapid lab testings and therapeutic drugs. The low-hanging fruits are consensus on disease with definitive treatment, such as malaria, leptospirosis, and others. Increase the yield of culture-sensitive report by accurate sampling. Ready to interact with the clinicians for guidance, support, and clarification. Pharmacotherapeutic committee efficiency. Data-driven approach. Involvement of clinicians, and define the surgical profile. Have appropriate antibiotic treatment according to the indications. Prescribe according to proper probable pathogens. Empirical treatment. Severe disease, comorbidities, and allergy. Review the right indication, right antibiotics, IV to oral switch, and microbiology results, and stop as per indications for the treatment. Regarding the indication for surgical prophylaxis, understand what is the surgical procedure, or prescribe according to the right antibiotic, right time, right duration, and right factors. Stop more than 24 hours after the surgery. Areas where IT can benefit the interventions include database on procurement and ward dispensing, calculation of the antimicrobial consumption, and and computerized physician order entry at advanced level. Thank you.